Welcome to the BACCH and BACAPH Improving Services series to support the implementation of the NHS long-term plan. This mini-module covers the design and delivery of pathways and networks, which is one of the most critical elements for successful NHS plan implementation. Before we start, let's just recap some of the NHS long-term plan key points. The NHS long-term plan was developed with a significant patient and professional group involvement, which in turn is reflected in its priorities. The NHS and its partner organisations with integrated health systems must always maintain a focus on the patient, and for those of us providing children's services, this must also include their parents and carers. Chapter 1 describes a new model of care designed on pathways, which is the focus of this mini-module. Essentially, all the parts must be in place and working well together in order to achieve good patient experience, safety and excellent outcomes. There is a focus on prevention, both at secondary comorbidities and primary prevention through population health management, and both of these topics will be covered in separate mini-modules. Overall, there must be a reduction in fragmentation and silo working, with an ethos of collaboration and cooperation rather than competition throughout provider organisations who all contribute to reducing inequalities and improving outcomes. Commissioning, delivery and regulation of patient pathways is the core business of the NHS, and it is essential to ensure all the parts are in place and working well. Pathway approaches make it explicit what is done, by whom, and how all the parts fit together within a service network. The collection of relevant data then creates feedback by creating measures that matter to both patients and clinicians. Quality improvement and prevention are embedded to enable improved equity in outcomes. This mini-module will summarise the findings from recent reports, briefly recap what is meant by systems thinking, and then go on to describe the basic components of pathways and how they come together to make networks. We have had a plethora of reports over the last 10 years. Not all have had a truly lasting effect. Most of these reports will be familiar to you, except for the Council of Europe report on child-friendly healthcare, on which the family-friendly framework is based. I would also like to highlight Don Berwick's report, A Promise to Learn, simply because it makes so much sense. You will remember that Don Berwick was the president of IHI in Boston and was an advisor to the coalition government, and I would recommend all his writings to you. Despite the very wide topics covered by these reports, they are remarkably consistent in their recommendations, which include having clear outcomes between all the different teams and organisations who have a common purpose defined by outcome. Integrated care. The NHS long-term plan highlights the importance of integrated care between health and social care and between primary, secondary and tertiary sectors of the health service, and removing the silos that sometimes exist between physical and mental health. Prevention should be embedded at every level to hopefully reduce overall costs in the long term. Participation enables a strong patient voice in the system, both to help drive improvement and the co-production of health. Measurement, information and meaningful feedback, and then action on the deficiencies is essential for quality improvement. Finally, a leadership style that spans organisations within integrated health systems will be a mandatory requirement. The NHS is a huge and complex organisation. In some ways it's remarkable that it works as well as it does, largely due to the commitment of the professional workforce. The NHS long-term plan proposes new models of care based on pathways, delivered by networks of people and teams who should collectively strive for continuous improvement within the proposed integrated health systems. This new way of working will require some understanding of systems thinking, which is a shorthand for understanding how all the parts come together to achieve a common purpose. Here we have an input on the left, a service in the centre, and an output on the right. Rather simplistically, the input is unwell patients, and the outcome is hopefully healthy patients. The input could also be a hazardous physical environment, for example road traffic, or a social environment, for example bullying. The important point is the output is always a changed input. The effect of this service is moderated by lifestyles and determinants which may help or hinder, but often are largely outside the immediate control of the NHS. There is a separate mini-module talking about life course pathways and tackling health factors such as lifestyles and determinants. The success of whole systems thinking revolves around the fact that there are multiple stakeholders, each often holding a different perspective on the purpose, priorities and design of a service and what a good service actually looks like. In order to effect meaningful change which is also sustainable, it is essential to involve and engage all stakeholders right from the start. For example, users may value the convenience of a local service over the cost or timeliness of such a service. Politicians may value plurality of provision to enable choice, whereas commissioners may value cost over choice. The time, energy and effort in creating a meaningful partnership and a shared purpose between various stakeholders should never be underestimated. However, it is also essential that stakeholders understand and respect each other's positions and work towards a common goal of improving health and reducing inequalities with a sustainable strategy. This table looks at different perspectives of users, providers and policymakers. The 4 E's are their primary concerns and the 4 A's are their secondary concerns. A separate mini-module will cover health economics and the definition of these terms. Users, providers and policymakers are all concerned with the effectiveness of the service. However, patients don't have to think about NHS costs or equity, whereas providers and commissioners do and must also consider cost efficiency and cost benefit. The NHS long-term plan stresses the importance of equity, which is rarely considered by providers. But how does a service become more equitable? This is considered in the population health mini-module. Now we will consider pathways and networks and leave values and learning for another mini-module. This is an overview of the family-friendly framework and is merely an aide-memoire. The family-friendly framework has 4 stages, each of which has 4 parts. This mini-module will cover the basics, pathways and networks, and the subsequent slides will explore each of these stages in more detail. Now let's consider a short-term condition. The term need is used in the sense of having the ability to benefit from a service. On the left are the needs of children, their families and communities represented by an orange triangle. On the right-hand side are the outcomes, which are hopefully resolved needs and relevant measures of value relating to efficiency, effectiveness and equity of service delivery. In the centre are the 4 basic components of service delivery, indicated by the circles representing prevention, recognition, assessment and interventions. This slide covers the basics for each of the component parts. Each component of the pathway should be based on best possible evidence, whether this be qualitative, quantitative or econometric, then delivered by competent practitioners in the right place and at the right time. Each of these component parts can then be expanded into more detail if necessary. So for example, setting can be described geographically, meaning place, internally, meaning space, and support, meaning IT, equipment, administration, everything that's required to successfully deliver that element of the pathway. Competence could be expanded to include clinical competence, the unique skills of that individual, cultural competence, meaning the ability to communicate well with children and families and understand their lives, and improvement competence, meaning the science of service improvement. Timing is always important and links to flow within the system. There should be no unnecessary time delays that would significantly impede the achievement of successful outcomes. The intention overall is to ensure that all parts are in place and working well together, and then this framework could be adapted for simple audits comparing practice with preset standards. Let me illustrate a short-term condition pathway using otitis media with effusion as an example. I will restrict my example predominantly to the issues facing the child, namely to manage the condition and the impact on the child. In other conditions it may be important to consider family and community issues, particularly in the injury prevention and child protection arenas. The pathway always starts with prevention. The incidence of otitis media can be reduced with the promotion of breastfeeding and protection of children from exposure to cigarette smoke. The condition can be recognised through concern or surveillance, and a comprehensive assessment will examine not just the condition and hearing, but its impact on the child, consequences for the family, and any community issues. Choices then need to be made, and a range of interventions may be required, ranging from surgical through to educational. Being explicit about the component parts enables providers to come together and be clear about their boundaries and working relationships. From a system perspective, all the parts need to be commissioned or planned, provided, and then regulated as a whole pathway. Clarity about the component parts will also mean there should be clarity about who is responsible for commissioning. In this diagram, NHS England is responsible for commissioning primary care, the CCG responsible for local audiology and surgical services, and the local authority in England is now responsible for the Healthy Child programme and for educational support. If the aspirations of the NHS long-term plan come to fruition, this complexity of commissioning should be reduced, with collective decisions made about the distribution of resources made within the network. Now let's consider a long-term condition. The four component parts of the short-term pathway can be replicated for a long-term condition. In the long-term condition, there are three phases. They are the initial phase, representing the recognition, assessment and initial management of the condition, a review phase, representing living with the condition, and finally the transition phase, which represents returning back to normality if the condition has been cured, moving on to adult services if the condition continues, or if the condition is worsening, a move into palliative care. It's important to note that the red circles appear in the initial, transition and review pathways, stressing the importance of primary, secondary and tertiary prevention at every phase. Once again, there should be clarity about who is doing what and how they work together within the network. This time the table represents the needs of the child, family and community on the vertical axis, with the phases of the long-term condition on the horizontal axis, with the component parts of each below each phase. This approach of thinking wider than just the condition is particularly important for comprehensive services, especially for safeguarding, where the majority of interventions are working with parents who may, for example, need mental health, domestic violence or substance misuse services. Community interventions are probably best illustrated by environmental adaptations for disabled children or community safety programs including injury prevention, for example reducing traffic speed or fencing swimming pools. The importance of the red circles which represent prevention is repeatedly highlighted in the NHS long-term plan and links to population health management, which is the topic of a further mini-module. It is very easy to overlook the whole system issues of purpose, values, leadership and learning that need to be addressed, particularly within integrated health systems. For a start, all organisations that contribute towards the health system should share a common purpose, which at a minimum should be to improve health and equity of outcomes, good value for money, and to be sustainable. Values can be derived from the UN Convention on the Rights of the Child and might include participation in decision making, promotion and protection as part of the prevention agenda, and a commitment to constantly improving provision. This creates a collective culture within services. Leadership needs to create alignment and synergy between all of the parts, for example, clinical, financial, commissioning and policy. Finally, systems need to be able to continuously learn either from research or from experience, and this must be part of the culture from the front line to the chief executive. Now let's look at an example of measurement. I've chosen ADHD simply because it's common, not because it's a particularly easy example, and I do not intend to be fully comprehensive, as we will only look at the review part of the pathway. More detail will be included in the mini-module dealing with measurement within pathways. One element and strength of pathway-based design is the development of meaningful measures that are incorporated at relevant points of the pathway. In this case, we will just consider the review phase of the ADHD pathway, and the measures offered are merely examples. The overall purpose might be to reduce school absence or school exclusions, so one of the outcome measures would be patient attendance compared to average school attendance for different year cohorts. Where provision is split between community child health and CAMHS, it might be important to understand who sees which patients, represented by referrals. The support that families feel they receive could be reflected in a patient-reported experience measure, or PREM. It's extremely important for the chosen measures to be relevant to all stakeholders and relate to high-level purpose and, where possible, outcomes. Where poor performance is identified, more detailed measures representing service delivery can then be developed, or audits compared to standards. This approach will be covered more in the measurement mini-module. So, in summary, service pathways are central to the implementation of the NHS long-term plan. Explicit description of service pathways enables the component parts to be defined clearly, allocated to appropriate providers, and measured in ways that are meaningful. This more collaborative or cooperative way of working to create integrated health systems will require leadership at all levels, coupled with financing systems based more on safety, value and effect than efficiency, targets and activity. In the long term, we need to create a learning organisation that has the ability to respond positively to changes in either technology, workforce or population health needs in order to create a sustainable system operating within the resources available. Thank you for listening. If you haven't already done so, please read the briefing paper that accompanies this mini-module and then look at further mini-modules for your next learning topic.